we, Bobby, do you want to speak on that?
We are following the measles epidemic every day. I think there's 124 people who have contracted measles at this point, mainly in Gaines County, Texas. Mainly, we're told, in the Mennonite community. There are 2 people who have died, but we're watching it, and there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
You sound a little under the weather yourself right now.
I have a permanently bad throat.
Hello, I'm Dr. Haydee Brown.
And I'm Dr. Sonya Sloan.
And we are eh-yah,
Black and brown women disruptors from healthcare and beyond.
Today we're talking about the measles outbreak in Texas, and what you just saw was the first cabinet meeting with RFK Jr. And our next clip is going to break down what it means and why we're discussing measles in the year 2025. Let's get to it.
Good morning to you, Robin. This is yet a grim reminder that measles is a preventable illness, but it can claim lives. That school-age child in Texas was not vaccinated. Measles, as you mentioned, was declared eradicated in 2000, which meant that there was no continuous spread of this virus for more than a year. Now health officials are urging the vaccine is still the best way to save lives and preserve immunity.
This morning, the urgent race to contain the spread of the measles as a severe outbreak in Texas has now turned deadly, claiming the life of a school-aged child. Health officials confirming the young patient was not vaccinated. The CDC saying this is the first measles death in the country in a decade. Doctors in Texas say they've admitted more than 20 kids to Covenant Children's Hospital in Lubbock, all of them not vaccinated.
The vaccine that we've given for 50 years. It is one of the most effective vaccines we have on the market.
Early signs can include high fever and cough, then a rash of red spots. The CDC now reporting 124 cases of the highly contagious disease centered in.
So, this is really horrible, right? This is really sad. This measles outbreak and the death of a school-age child is a chilling reminder of the real deadly consequences of declining vaccination rates. Texas is now grappling with this measles outbreak that has already claimed lives. Measles, which was eliminated in the United States back in 2000, is making a disturbing and dangerous and deadly resurgence. This disease, which had been nearly wiped out for decades, is a horrible threat for those in the state of Texas and beyond. So the last measles-related death in the United States was over a decade ago in 2015. But this outbreak shows us that despite years of progress, we're all still vulnerable. This tragic death connected to this outbreak is a stark reminder of what happens when we fail to protect ourselves and our communities with vaccines. The measles vaccine has been around since the early 1960s, so this should not be happening. This is all made worse by the growing mistrust in science and public health institutions, and it's being fueled by misinformation and the anti-vaccine movement. And as a result, diseases that we thought were completely gone are coming back with a vengeance, threatening the lives of our children, our elderly, and our most vulnerable. So to paraphrase a recent guest on eh-yah, we are victims of our own success, right? In the early 1900s, women had 10 plus kids, and it was kind of banked into it that you would be losing several kids to early childhood illnesses like measles. And so really, it's a bit of what we call a luxury that we're even able to think about chronic illnesses, meaning illnesses, past the first few years of life. And so the implications of this outbreak just go beyond the health of Texans, right? It really exposes our issue and the cracks in our healthcare system. It's that this dangerous rhetoric continues to erode our progress. So this crisis demands immediate action from our public leaders, our professionals, from everyone. And we have to push back against these lies. And if we don't, we're going to see more outbreaks, more preventable deaths in the future. We cannot allow preventable deaths to define the future of public health in Texas and the United States. These stakes are too high to ignore. It's really time to prioritize and place the safety of our children and communities first. What do you think, Dr. Sloan? You're a native Texan.
I know, and I don't know if I should apologize on behalf of Texans everywhere, my state, we're grappling with this devastating measles outbreak. Kids are dying. And then the fact that Robert F. Kennedy Jr., the current Secretary of Health and Human Services, has remained disturbingly silent, if you will. I mean, we're still, during the whole recent cabinet meeting, RFK Jr. reportedly minimized this tragic death of a kid, of somebody's child that was linked to measles, of course. And then this just really highlights his whole response was that there's dangerous consequences going along with his anti-vaccine stance that he's had in the past. Because in the past years, at least, he spread misinformation about vaccines. And even in his recent remarks reflect disturbing disregard for public health. And so as the head of the department responding to safeguards for health of Americans, his failure to address the outbreak and him minimizing this child's death is not only irresponsible, this is very concerning. So while people and the public health experts out there and medical professionals like you and I, Dr. Brown, work tirelessly, trying to contain outbreak, RFK Jr.'s silence and dismissive attitude signal his inability to lead effectively in a crucial moment in history. His refusal to even take decisive actions as the Secretary of Health and Human Services undermines the very trust in science and vaccines that we desperately need to combat with a preventable disease. So the question now is, how can we trust a man in such a critical position when he minimizes the death of a child and refuses to address real danger posed by misinformation? RFK Jr.'s rhetoric is putting more people's lives at risk. It's time now for him to be held accountable for his actions. I think the America's public, we deserve it. We deserve leadership that's rooted in science and compassion. It's time for RFK Jr. to stop minimizing the consequences of anti-vaccine agendas and take some damn action to protect the health of the safety of not just American children, but all Americans. That's how I feel, Dr. Brown. What do you think?
This is just disheartening. There's a word that keeps coming up, preventable. A school-aged child died in Texas. They were not vaccinated. So a child died of a disease that we previously had eliminated in 2000, right? So we're 25 years later. So back when Dr. Sloan and I were in medical school, measles was practically a thing of the past. It was almost an afterthought. We'd never seen a single patient with it. It was eradicated in the United States. We could only see pictures in our textbooks. And yes, we actually had physical books. Textbooks, like you would open them and look at them, right? Right. We had a recent guest, Dr. Bonde Virgil, who's a board-certified pediatrician, to actually speak about this. And she said something incredibly poignant, and I will quote her, particularly about children, right? The pediatric patients don't have agency. They don't have the ability to speak for themselves. So we are all proxies for the children in our communities. We are proxies for our patients. They can't vote. They can't lobby. They can't speak about their experiences. They are entrusting all of us. So we as eh-yah want to encourage our viewers to get their medical information from trusted sources. A great place to start is the American Academy of Pediatrics, their website, healthychildren.org. It's reliable, and it's important for you, all of us, to know how to protect your health and how to protect your children's health.
Yes, please protect your health and your peace. So we thank you for watching. We're eh-yah, contributors of MeidasTouch Network, and we're proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at meidastouch.com/newsletter.